Hi, my name is Kelly Martinez, and today I will be talking about an elimination disorder called enuresis. Enuresis is an involuntary or sometimes intentionally bedwetting. This happens usually at night, but at times it can happen during the day. At night, it typically happens when a child is in their REM sleep, and this means that the child is unconscious and isn't self-aware of their elimination, basically bedwetting. This typically can make a parent very frustrated, not knowing what to do or how to basically deal with the situation. Um, as well as a child, this can also make a child feel very stressful. It can increase anxiety. The prevalence rate is 5 to 10% in 5-year-olds that experience bedwetting, and 10% to in 10-year-olds, and 1% in 15-year-olds. This typically diminishes around age 8 to 10 years old. If not, there are treatments for this disorder. There's behavioral therapy. There's a treatment that basically reconstructs a child's pattern. It's basically they restrict drinks for the child, and it's teaching the child how to um, keep the bed dry. Um, Also, there are other factors and reasons why a child may be experiencing enuresis. There are medical health issues, such as a child who has diabetes or a child who is suffering from spina bifida. There are also cases with children that have ADHD, having recurrent bedwetting problems. It's also very common for children that are going through some type of stress, either at school, at home. An example I can give is a child who's one of their parent leaves. That can be a very stressful event for a child, and it can start a cycle in having a child regress their feelings, and it can cause enuresis. Basically, the child is holding their feelings, not telling people exactly how they feel, and the result of it is they're wetting the bed. Um, Also, there are medical treatments, and there are alarms to put in a child's bed to not have this to happen. And typically, positive reinforcement is a very good strategy to help a child dealing with this. Negative reinforcement is not going to help a child get out of this stage. It's only going to make the child feel more basically shameful of themselves, shameful of the situation, and it's not easy for a child to understand why something like this is happening, and it's it's something that parents should be very mindful and definitely talk to their children and um, use different strategies to basically be there for them, like I had a situation, my daughter, like she was 5 years old and she was fully potty trained, and she was fully potty trained from the age she was 2 years old till she was 5, and basically happened around the time her dad left. So I initially knew that was the stressor and why it was happening. Um, if it wasn't for me taking all these child development psychology classes, I would have been one of those parents who would have just completely lost it and been like, why are you doing this? Are you doing this on purpose? Um, but I like stopped myself, and it was like, okay, what can I do to help her, for this to not keep happening? And basically what I would do is I pretty much eliminated drinks by like 6. And then after that, I would wake her up every 3 hours, have her go to the bathroom. Sometimes, because she's a very, very deep sleeper till this day, um, it was very difficult to wake her up. So there was times that I would have to carry her and take her to the bathroom, or like, just wait till she wakes up. And it's like, I'm not gonna lie, I'm not gonna say that it was easy. It was definitely rewarding. After, it was like days and then months that she was dry, and I use that positive reinforcement. Like, I try not to look so much in the negative when she did have those moments that she would wet the bed. It was more like I would try my best to give her that feeling like she wasn't alone in this, that I'm here too. And definitely learning a lot about enuresis has helped me better understand other factors of this, because it could be genetic, it can be a stressor, it can be something, like a urine tract infection. There's like so many factors, and as a parent, it's very overwhelming, but finding out the solution for the reason why this is happening is amazing.